Hi there, I'm Dr. Jesse Morse, and I am a sports medicine doctor here at the Osteopathic Center in Miami. Let's talk about a very common injury that many runners complain about. They namely call it runner's knee. What is it exactly? Why does it happen? What does it feel like? And how do you treat it? So this is also known as Patellofemoral Syndrome. And I have a nice little model here that will be helpful to show exactly what's going on. So what happens is there's an irritation of the kneecap at where either above the kneecap or underneath the kneecap. So the kneecap essentially slides in a groove up and down, getting pulled by either the tendon above, which is the end of the thigh muscle, or the tendon below, which attaches to the lower leg bone. As it slides up and down, it gets pulled, and it's supposed to slide smoothly over the top of the bone underneath and underneath the kneecap. The cartilage underneath the kneecap is actually the thickest in the body. But unfortunately, there are a bunch of ways that we can damage that cartilage, which leads to what we're describing. So most people will describe a pain on either the top part of the knee or underneath it. They may feel like when they put their fingers underneath the kneecap, it will slide and it will kind of crunch almost, and it doesn't go smoothly. Sometimes it will even go and then it kind of goes. So you could tell it's catching on something. A lot of people will have something called the theater sign, which basically means after sitting for long periods of time and then getting up, they will have this pain in this area. That's a very common cause of this. Also, we can have running downhill or even walking downstairs are all very common signs associated with this injury. So if you feel like, oh, that applies to me, this is your diagnosis. So there's a couple ways that this happens. You can have some issues with the bone underneath it that are more genetically related. You can have the kneecap can actually be out of sync in terms of balance, whether it's naturally because your body, it wasn't perfectly created, or because one of the muscles on one side of the thigh is weaker than the other. So as we see, this is the outside leg, so this would be my right leg. Usually the muscle on the inside, what we call the VMO, is usually weaker than this one. So what happens is this muscle is stronger and it's gonna push that kneecap. If it was perfectly, if they were perfectly equal in terms of strength, both would even and it would just slide up and down. But since this one's stronger, it pushes and now it rubs underneath the kneecap in an abnormal fashion, and that starts to rub and cause issue. The other issues, a couple other things, you can have a tight IT band so that if you run your hand along the side of your leg from your hip all the way down to your knee, there's a thick band, what we call the iliotibial band or the IT band, and that has a tendency to play a role here. If that's really tight, that's going to push the kneecap inward medially, and that can cause this issue as well. You can also have issues with hip adductors and some of the external rotating muscles up and near the groin and the upper part of the hip that play a role, which indirectly will lead to this issue as well. So how do you treat this? First of all, you need to correct the abnormal forces that's causing this issue. If you just inject something in there, then you may temporarily correct the issue, but if you don't correct the cause, it's just going to happen again once the medicine wears off. So you have to correct the underlying issue, and that usually responds or at least analysis by a physical therapist, someone that watches what you do, exactly figures out what's causing it, and then they work on getting you back to square one where you're no longer having that issue, whether it's strengthening the VMO, whether it's loosening some of the muscles, whether it's retraining some of those hip imbalances so that this knee finally calms down and you no longer have the pain. You can do injections in here. This is not an area that you'd probably want to put cortisone in. You can. It's only going to last for a little bit of time, and you're essentially just temporarily numbing up the area and calming down the inflammation, but it's not going to structurally change the tissues beneficially. And some people think that it may actually even detrimentally hurt them because you're weakening some of the cartilage in that area, especially if you happen to hit the cartilage with the needle head. This is usually diagnosed between x-rays, oftentimes an MRI, and with the help of a clinician who sees exactly what's going on and has treated it before. So this gives you an idea of exactly the different options for runner's knee, for patellofemoral syndrome. You can take it one step further and actually inject something in there to prevent and help maybe slow down the damaged cartilage and potentially reverse it in the form of regenerative medicine, or stem cells, or PRP, or amniotic tissue allograft, depending on exactly what the severity of the damage and what you're trying to accomplish. But there are options, but the first goal is diagnosing it. I hope you enjoyed the video. Please hit the thumbs up and check out some of the other videos in the links below. Take care.